So guys, in my previous video we will learn the format of OET exam, and in this video we will discuss about the tips and hacks of all four sub tests of OET exam. So we'll start with the listening practice. As you know that in the listening there are three sections, A, B and C. So we'll start with section A. So in section A, the first tip will be which is the most important tip, that you should start listening practice from very beginning and continue till the end of your exam. So usually, in our lectures, we have a habit, we have a very short span of focus. But in a listening test, it's very important to listen everything and focus on each and everything. So first of all, when your section A starts, you will get 30 seconds to read all your blanks, and you should mark the word in the start of your blank, and also mark the word at the end of your blank. So when the sentence when the recording will start, you will get idea about your blank. So after that, in a listening section A, the mostly there is a conversation between doctor and a patient. So the mostly blank will be maybe a test, maybe a diagnosis, maybe about the symptom, maybe about the medication follow-up, or allergy, or mostly a vital. So these are the blank will mostly will come in the exam. Okay. So and the most important tip will be that don't worry if you miss an answer. You know that you should not lose your hope. You know that mostly people in a listening session, if they miss one or two blank, they lose confidence. So the confidence is the key, because listening is the first subtest. So it is very difficult to focus on the exam. But once you clear subtest one, and then you will get the used to of the environment of the exam hall. So that's why it's very important, that you should carefully read your blank and then prepare yourself. And also uh, if in the paragraph contain two or three blank, then you should use a short key. Like if there's an investigation like ultrasound abdomen, then you write in a short way. So at the end of the exam, you get a few seconds to fill your blank. Okay. So like I already mentioned, use 36 and very timely. Use a keyword before and after the blank. Pay attention to the word of patient in a part A. And predict the answer. Like diagnosis. You can predict the disease and diagnosis, and you can use the abbreviation of like BP, ECG, diabetes mellitus. Small spelling mistakes are allowed in listening, as it doesn't change the meaning, but it is not allowed in reading. We will discuss on later. Uh, as the instruction you hear only recording once time, that's why it's very important to stay focused. And also sometimes to answer will come too quickly. Yes, there is a test. One sentence may contain two blank or three blanks. So when you That's why the use 30-second is very crucial, because you have get idea that which part of your listening you should be more quick. So then we will move to listening part B. So in this part B, you will get slick six short conversation or maybe short presentation, and you have 50 seconds before before each blank started. So you should stay focused on. Uh, be aware of filters sometime. They try to confuse you talking about one assumption for a long time, and then will try to convince you for the one correct option, but suddenly they will flip their statement. So that's why it's very important, to carefully focus on connectors like but, however, therefore, furthermore. So try to listen very carefully at the end, and you will get a 5 second at the end of audio to answer the question. So you have to circle your answer. And yes, the target for section part 1 will be 24 or 23. 22 is also okay, but then you have to score at least 4 in part B. So if you score 24, then you have to get only a 6 MCQs right for section B and section C to get the answer score of 30. So tips for section C. Section C will contain two conversation or two paragraph and a long paragraph, and each contain 8 MCQs. So you will have a 90 second before the recording start. So again, it is very important to use that time very importantly. So in part C, you have to keep the track of which question the recording referring to and read carefully each recording so you get a clear idea about what this audio is. Multitasking. So you have to also listen the recording and also uh, you know focusing on the task, which means you have to read the question and underline the keyword and listen the audio at the same time. So it's very difficult, but with the regular practice you will learn. So the target score will be 8 plus. So if you get 24 in a section part A, then you just need 6 more correct answer. Okay. So during last week exam and exam day, I prefer to uh, you can skip listening to the instruction as you already familiar of that, and utilize that extra time to underline your uh, the extract, or maybe keep calm, or you get more time for reading. Same for the part B and same for the part C. So you'll get 50 more second in your 90 second if you start reading instruction time. So underline the keyword and try to understand the context. So many people have a good listening skill, but if you don't have good listening skill, try to watch documentaries, podcasts. I will give you in this video. So the tip will be read the 4 questions with their answer option and use the keyword. Okay, so I will prefer to read question and answer and also underline it in a 90 second, and When you're done with your all the 8 questions, then come to again the first question and read their option as well as to get familiarized with. Now we'll move for. Okay, so let's discuss about the reading text. So we will formalize with the reading test instruction in your practice test. So at the test day, you can focus more on answering the questions. So for part A, you will get only 15 minutes and you have to answer 20 questions. So I will suggest the technique of skimming and scanning, that you start with your four tasks. In the four paragraph will be given and they ask the answer. So uh, you should scan all the information like paragraph A mostly are about introduction, paragraph B mostly about the sign and symptoms, paragraph C whether it about the treatment or management, they and paragraph 4 maybe about prevention. Mostly the four paragraph will contain these information, and after that we suddenly start. I will suggest there are two techniques the many people use. Answer start from 8 to 20 question, then they come to 1 and 7 question, and other start in a series wise. So you can try both and find which thing work best for you. So you know mostly if you start from the 1 to 7 question, you will get an idea about the four paragraph. You get an idea the which information contain which paragraph. uh, be aware, use correct spelling, maybe American or British, but like unlike the listening you will lose marks if you do not use correct spelling. Use exact the same word which is given in paragraph. Abbreviation are not acceptable. So in reading B and C, you can use QTA pattern, question task answer. I would suggest you can also first read the question, read the answer, then go to task, or read the question, read the text, and or go to answer. Try both and see which will work for you. I personally suggest to try to read question and then answer and then go to the text. Again, exclude any incorrect option. And if you don't find your answer, then try to eliminate the other two options. So in this, two words are very important, however and should. While reading the test, looking for the answer, try to focus on word however. Usually the sentence start with the however contains the numerous information of the answer. While reading the assumption, if you find the word should in any answer option, assume that may be a incorrect option. However, I'm not say that it will work 100%, but usually it is seen on many exam pattern. So when you see the word however, you should try to focus on the information they contain in the sentences. So if you are poor in particular part of reading, try to focus on that part specifically, like part C of both listening and reading. Usually they are very hard and people find hard to pass. So you should try to on these part. So on examination day, you need 30 correct answer out of 42 to pass. So if you are poor reading and can't solve part B, so you can start with part C and then you can come to part B. Usually, part B are easier compared to part C, and part C, there most chance that one task is difficult than other. Okay, we will moving to writing part. So, there are six types of letter, six writing criteria. So, referral letter, so you get a 5 minute to just read the task, another 40 minutes to write it. So, refrigerator, there are two types of refrigerator. One is simple refrigerator, other is urgent refrigerator. So, refrigerator mostly written by GP to a specialist doctor, or urgent refrigerator mostly written to a ER doctor. Other is discharge letter written by the specialist to the GP. And other is transfer letter is mostly written by GP to other specialist. So these are the main criteria to fulfill the purpose. The purpose should be clear. So in purpose, you should mention the medical issue, or the provisional or final diagnosis, or about the symptoms which is patient experiencing. The content uh, exclude the all the non prevalent information. Like if the patient has MI, there's no need to give write about his any past medical history which is not related to cardiovascular system, like about if he had a fracture or if he had operated for hernia. So there's no need to write of that. Style, use mostly formal words, no symbol, no local abbreviation unless it's a universal abbreviation. Uh, Layout, organization, very important. Structure is very important. The first paragraph is introduction, and second is about if it is a refrigerator, the first paragraph should be about introduction, second about the patient, general physical, social history, and the third paragraph about the patient initial visit, and fourth is about uh, patient subsequent visit, or uh, today's visit, and in this last it will be a conclusion. Language, grammar, vocabulary, spelling, punctuation, these all are very important in a writing task, because it is English test, not your clinical knowledge test. So, uh, refer letter. First of all, who are you writing to? Specialist doctor, occupational therapist, or physiotherapist. Okay. Does the reader know the patient? No, because when a GP writes the specialist, he doesn't know about patient. So you should give the social history if there is any comorbid or any allergic history or any family history or any past medical history. So you should give the GP. Try to finish the word limit of 180 to 200. It is a very ideal limit. Okay, yes. Always reread your letter in the end of your research. You should plan your writing that you get enough time in your 40 minutes that you can reread your letter. So this is a part of refer letter. Doctor name, his specialty, his address, the doctor you are referring to, the today's date, and the patient full name and age. In this introduction paragraph, uh, if you can give your patient occupation, patient medical issue, and if he's suffering from any specific symptom. The first body paragraph is about the examination, finding, treatment, complaints. It is about the patient initial visit. And second is about subsequent visit, and in third 2-day visit, and fourth it about conclusion. And you salutation you add like, should there be any, feel free to visit me if there are any queries. And closing you write you sincerely. Okay, if you know the doctor name you write so yours sincerely. If you don't name the doctor you write yours faithfully. So it is the urgent left writer. The difference between the urgent left writer and simple left writer is that in urgent left writer the 2 days visit come first, and then initial visits, and then subsequent visit, and the end. You can write you do not have to write a social history if there is no any significant. In discharge where you do not write a social history of patient, because in discharge the specialist uh, sending back patient to his GP, so GP knows everything already. But in urgent letter the social history will come in the end, unlike the simple referral letter in which the social history come first. So it is just opposite of simple referral letter. This is a simple refrigerator and this is a urgent refrigerator. Okay, so how it can be right is a, so this is a task which will be given in your exam day, and you have to write like that. This is the introduction paragraph. This is the initial visit. This is a subsequent visit, and try to write all the other visit in the second and third paragraph on starting like on the subsequent visit. So in this way you will get your target count of 180 to 220. And this is the social history, and the end it is a conclusion, salutation, and closing remark. You are sincere. So on discharge letter, uh, you will there's no need to write a social history of patient. Just write introduction to what happened in hospital course during the stay of hospital, and recent situation, any advice of the family. So there is no need to write a past family history. In conclusion, so you can uh, write patient name or patient age, which any of them, which will be given on a paper. So mostly tense used in letter is simple present, simple past, present perfect, past present. So in my next video we will look for the grammatical mistakes in a writing task. Okay, the last but not the least, speaking. So we'll get 20 minutes for your speaking, and this is a role play card. You have to speak for 5 minutes and try to cover all the points, and you will get two role play cards. Uh, 5 5 minutes each. Okay, so these are the criteria uh, you will judge for your grammar, your fluency, your appropriateness of language, relationship building, understanding, providing structure, information gathering. These are the criteria in which you will be judged. Okay, so these are the uh, tips for the speaking. Okay, so try to learn the basic structure, memorize some reassuring words or phrases, um, and try to listen to your partner, uh, try to sympathize, and these are very reassuring statements are very important. So for speaking, you need a practice with your partner. So these are the basic structure. You start with greetings and then introduce yourself and tell uh, ask about the patient name and age, and then ask about the query, the reason of visiting, and then try to cover, make a conversation and make a interactive, ask questions, emphasize the patient, reassure the patient. This is a very important in a OET exam. So these are the different types of reassuring words. You can memorize it. It will help for your exam. I will share this PDF and it will help you guys. Okay, so thank you. In our next video, we will focus on uh, grammatical mistakes in the writing test. Thank you.